The next technique we're going to demonstrate, we're using Rejuvenate blunt PDO threads, which are delivered via a cannula. They're 30 gauge, 38 millimeter. So you can see this little white dot. I've already injected some lidocaine with epinephrine, so I'm going to make a tiny hole for the cannula. The great thing about these threads is that they're delivered via microcannula, so the thread is tiny. I'm going to go through that tiny hole that I made. And what I'm doing here, Amy has a little bit of malar edema, and so right below the area of malar edema, she has a little drop off. So my goal here is to provide a subtle amount of volume to feather in that area of volume loss right below the area of malar edema. And so that's one. I'm going to do two, and this will be the third one. And what happens is, over the next several months, the body will reabsorb this PDO thread. PDO stands for polydioxanone. It's the same polymer that's used to make absorbable sutures. And while the body is reabsorbing that, collagen will be produced. So if you think about it, this is a means of a very precise subdermal collagen stimulation therapy. Same thing on this side, a little bit different. On this side, she just has a little bit of volume loss and under the in the tear trough. So that's why the vector is a little bit different here, but the technique is the same. We go in through that tiny hole, and I've kind of pre-marked the area of volume loss. So I go in with the thread. There's one. Second one more. Now, these threads have been around for a couple years in the United States now, but these cannula deployed threads are fairly new, and they just are safer, less traumatic, less painful, and great advancement in this technology.